today we're going to be talking about genetic testing. I have a couple questions for you today.
Okay.
All right, so what is the science behind genetic testing?
Genetic testing. Well, the science behind genetic testing is that everybody has chromosomes, and on your chromosomes, that's your DNA, you have DNA that eventually make enzymes in your body, and enzymes are things that put the color in your eyes, and they make the proteins that are helping your body to work. So, in psychiatry, being a psychiatrist, your body has certain enzymes that help break down medications. And so if you don't know what those enzymes are, the doctor really doesn't know how quickly or slowly the medications are being broken down. And that can affect how effective they are or not for a given patient. Also, proteins make receptors in our brain. So if I'm using medication to affect the brain in some way, then I need to know what type of receptors one has inherited. So that's the second reason we get it. First being, how does the body break down the medication? And second, what kind of receptors does somebody have? Because if your receptors don't respond to a certain medication, then we might not use that medication. And the third thing we ordered for currently is to see how well your body converts folic acid to activated folic acid. And activated folic acid is called L-methylfolate. And what a lot of folks don't know is that they actually have what we call mutations. Now, this is not like mutants, like Teenage Mutant Ninja Turtle type of thing, but mutations are just where, kind of like eye color, where, if you have blue eyes, you might have a certain type of genetic code that is rarer than what most people have. So let's say 75% of people have brown eyes and 25% of people have blue eyes. Well, when we're prescribing medications and treating like depression, it's helpful for us to know, in this case, folic acid, because if you are the blue-eyed variant of having folic acid issues, you may not know that. And people who have that kind of recessive trait or those mutations are people that may not respond as well to antidepressants in some ways, or they might need some supplementation with a special type of folic acid, which is L-methylfolate. So I know it kind of sounds confusing, but to summarize the science of it, we're either checking your liver and how quickly your liver can metabolize meds or how slowly it metabolizes it. Second thing would be the receptors in your brain. And then the third thing would be the folic acid enzyme, which is called MTHFR. And it converts folic acid to L-methylfolate.
All right. When do you decide to order genetic testing?
Well, I often see like second or third or fourth opinions, people who have been in treatment for years, especially when doing treatment or when treating treatment-resistant depression. Sometimes folks are resistant because there are medications that don't work with their genetics to some extent. So if I have a patient come in for the first time and they've been on more than 3 or 4 antidepressants, then I might order genetic testing right out of the gates. And in fact, for every patient, we offer it at their first appointment, unless they've either never taken medication before, or they have a very straightforward case, or if we think they just are here for therapy, like psychotherapy, talk therapy, and they're not really going down the medication route yet.
Okay. Does it hurt?
No, genetic testing doesn't hurt. We just swab your cheek here on site. It takes literally a second to do that. And then we send it in a package to a lab that gets the results to us, so it does not hurt.
Okay, and how much does it cost?
We don't charge for genetic testing at our office, except for the time we spend with patients consulting with them. So that would be like the first visit and the follow-up visits with me or with our other psychiatrist here. But the lab company, one of the lab companies we use, I think they charge around $300 for the genetic testing, which is of great value because remember, you can have this genetic testing for the rest of your life. So it's not like you're checking sodium, changes minute by minute. This is something that you have forever. Now, there may be more genetic testing that's discovered or invented over time, but the bulk of what we learn from it, I think, has an incredible value, and I would want to know what my genetics are, especially if you were to take medication. And so insurance sometimes covers it, but if insurance doesn't cover it, the company that we use will often give you a flat rate of around $300. And I think they have sliding scales for folks too. If you can justify that, like you're not working, or if you have if you don't have a lot of income to get it, then I think they will give it on a sliding scale, meaning less than $300.
Okay. How long does it take for the results to come back?
Usually get the results within 10 days. Unless there's a glitch, sometimes the sample en route, there can be a problem with it, or it can get lost. That's pretty rare, but usually we get it back really quickly. And I'll usually order it at a visit and then have it for the next visit within 3 weeks. And then we'll go through a 45-minute meeting with me, and I'll go line by line and explain what I see. A lot of times patients would rather I just read it and interpret it, or use it as a tool later down the road while we're making medication changes. And the reason for that is it's highly technical, like to read it. So it's not like 23andMe where you read it and you know what to do with it exactly. You need a clinician to kind of go through it and interpret it. And one of the things I should mention is the genetic testing that we order will often say that a medication is in the green zone, the yellow zone, or the red zone of whether your gene's affected or not. But that's misinterpreted sometimes. I've seen by clinicians where they might think like you can't use that medication in the red zone, or the patient thinks like they can't use it, which is not true. It just means that the clinician, the doctor needs to know that, for example, if you were taking Prozac and you don't metabolize Prozac very well, you could still take it theoretically, but you may want to start with a lower dose, especially in somebody who has anxiety, because Prozac can make you kind of feel more amped up than not. So that's a good example of where I might start at a therapeutically much lower dose, knowing that the patient may not be able to tolerate normal doses.
Okay. All right. Thank you so much.
You're very welcome. Bye-bye.